Hello everyone, this is Uzi with Able Company of 4C Marketplace Venture. We help companies around the nation, around the world with implementing fever screening systems. Today I want to talk about FDA guidance and the importance of good implementation. Before we get into the implementation side, I know you're excited about that, FDA plays a crucial role in governing thermal screening devices, right? So the FDA, and I believe it's their Center of Devices and Radiological Health, they regulate the use of medical devices, whether it be, automated wheelchairs, kind of your CAT scans, but they also regulate the use of thermal cameras. A common clearance that you'll see out there is the 510K clearance. It's a pre-market clearance to allow that device to be used for the purpose of a medical screening procedure. Yeah, in this case, a thermal camera is able to look at and screen for elevated body temperatures, right? So why is that important? It's just a matter of standards. It's a matter of standardization. They're basically putting their stamp of approval on this system, saying it is safe to use for that purpose, right? So where does this play into the current market? Well, if you're like the many other companies out there, you're looking and surveying this whole landscape of different solutions. You got all these guys on this side of the house using AI thermal screening devices saying, okay, listen, we can do it. We don't need X amount of things and we can scan 16 people at a time. Pause, right? And then on the other side of the spectrum, you have the systems that we use, which are kind of ISO assembled assemblies that use a FDA cleared camera in conjunction with a temperature reference device, or what a lot of people call a black body, in order to screen accurately the surface temperature of the target or object, which is a person walking through the frame, right? So two sides of the spectrum. Here's the interesting part. The FDA recently put out a notice saying that they aren't going to enforce some of these, solutions out there that are marketing in a certain way for certain purposes. Now, there's a lot of pushback in the industry about that, but the biggest reason, their stated purpose, is to ensure that if someone wants a device, devices have different price points. If someone wants a device, they can put it out there. Now, what you as a customer need to understand is that it's all about risk. It's all about risk and liability. So if you understand the standards involved and you're doing something for a specific purpose and you understand the standards involved and you choose to use something that is not to the standard, how are you going to mitigate that risk, right? That's a decision you guys need to make. That's a decision, a lot of people are facing right now as they look at the various range of solutions and say, I like this one, I like parts of this, I don't like the interface here, because there's, again, going back to a previous video, we talked about the number of different system design factors that are out there. Safety, accuracy, and user interface is a really big one, right? So going back to the FDA and their guidance, although they did say and talk about that enforcement activity, one thing that they did put out was another set of guidance talking about if you're going to use these systems, what are the right conditions you're supposed to use it in, and what is just general guidance for using them. And some of the general guidance that they put out was that these devices are meant to scan one person at a time, right? So solutions out there that are, saying that they can scan 16 at a time accurately, FDA says, generally speaking, these systems are meant to be a medical screen for the purpose of screening one person at a time, right? So in addition to that, they're saying if you're going to use these systems, use them in a manner that is in the correct operational environment, as well as with people who are properly trained, right? In relation to this FDA guidance, where I'm just gonna show you just how important it is to do a proper implementation. All right, so use case one was we went to a luxury golf community. They wanted to open their clubhouse back up, and they were going to use this system as a means to do that, right? To accurately scan and efficiently scan for people going into the premises. So what that looked like was we set it up, but we noticed that there was some inaccuracies involved with this setup. What we did was we just looked around and surveyed the area. Right and nearby was this really big mirror. That's a potential source of reflectivity. but we identified the source actually as a sunlight. So the sunlight had blinds. We just asked them to simply put the blinds down because that sunlight was allowing the sun to directly expose that camera system, throwing off the accuracy of that system. The next system or use case that we had was actually an office building. So like many out there, modern office building. So you have beautiful, shiny panels, right? Shiny panels, shiny floors. But what that does for thermal cameras is that actually throws off that camera's ability to accurately track where it's trying to read the hottest pixel in the frame, right? So if you can imagine the picture, you're seeing heat sources directly in the frame from what's being in front of you, as well as reflected through these shiny objects, right? So again, we went in there, identified everything, and mitigated that using our different techniques, right? And then last but not least, we had a manufacturing setting. The day that we went there, it was raining and they wanted to test this out. So we tested it out, it was raining, and what they did, their operating procedure when it was raining was to take this big industrial fan and blow the floor in order to keep it dry, right? So when we set this up, we were just wondering why was this camera just not getting a good read? What ended up happening was we identified that the fan was blowing directly at the camera, and it was blowing at a very cool temperature, and it was throwing off the accuracy of that camera device. So those are just 3 different use cases where, accuracy was important. We kind of followed the FDA guidance. This falls in line with the FDA guidance, right? In order to ensure that when you're employing these systems, you're doing it in a way that is correct in the right operational environment, mitigating all the things that could throw off the accuracy with people who are properly trained, right? That's where Able Company steps in. We help bring the camera solutions, but we also implement the programs around the camera solutions and mitigate all these different things in order to assist you with keeping your workplace safe from transmission events. If you have any questions, feel free to reach out to me in the contact information listed, and we look forward to serving you soon. Thank you.